Welcome to one of our twice monthly programs on uncommon awareness called Evolving the Species. This is a special program that I do twice a month with my very, very good friends and colleagues, Dean Lloyd and Am Rosen. And we developed this idea of a roundtable because we want to engage professionals in a conversation that helps listeners understand how we as practitioners are constantly evolving, asking ourselves kind of tough questions, asking ourselves how we can better meet your needs and serve you. So you want to learn a little bit more about Dean, and you want to learn a little bit more about Am. These are my co-hosts, and you can learn more about Dean at accutone.com, all right? And his name is Dean Lloyd, and Am Rosen at lifegame.com. And because we do this program twice a month, I just don't repeat their biographies over and over again. You can pick them up at my website, or you can go to their websites and learn more about the work that they do and what phenomenal people they really are. These gentlemen have a true heart for helping us who have the opportunity to listen to them, hear them, and speak with them, to move us along, to evolve the species, hence the name of our program. Now, tonight we're really honored to have Dr. Steve Hines with us. He's a naturopathic doctor, he's a naturopathic endocrinologist, and a master herbalist. He's been practicing naturopathy for 15 years and is currently writing a book, Gastrointestinal Diseases, and he's also co-authored a book called The Road to Health. He has more than 12,000 hours of training in nutritional biochemistry, anatomy, and physiology. His deductive reasoning skills prove invaluable to his patients. Well, he's also an accomplished musician and humanitarian, and he's established a laboratory. Like, if you've been listening to the program this week, you understand that a lot of the things that are going on with us can't be identified or distinguished through laboratory testing. Steve has gone above and beyond to try and help us sort this out, and he's going to tell us a lot about that. As usual, my good friend Dean is actually going to host this program. The rest of us are just waiting with bated breath to hear what he has to say about anything. And so with that being said, I'm just going to bring Dean on. Good evening, Dean.
Always a pleasure, Lorraine.
Hey, and we've got some websites for Dr. Hines that I didn't give. I'm going to pull those up quickly. Steve, I didn't forget about you. Just as we go along, I'll get those websites up, and we'll let people know where they can go to find out more about what you do, who you are, and what's going on. But, Dean, please, take it away.
Take it away. Well, I want to know, with Steve here, what is it that his perspective is on the most serious of our issues in health? And we decided to talk about chronic degenerative diseases today. And it just so happens you're in Florida right now at one of those conferences. Is that not so?
Yes, I am. Starts this evening in about an hour.
Oh, that's wonderful. Is it an ICAM conference?
It's ICAM, which is Lee Cowden's conference, and we have Sherry Rogers, we have Dr. Sinatra, and Joseph Mercola over the next 2 days. So just talked to Sherry a while ago, and I told her I've read all of her books. I mentioned 3 of them. She said, you missed 14 of them. There's another 14. I said, I'm out of the loop, I guess.
Yeah, I know. I've met Dr. Rogers. And hey, listeners, I'm sorry, Dean, I want to throw out a quick statistic.
Go ahead.
75% of us will succumb to chronic degenerative disease. This is a really important topic for us to understand. Right. These aren't things that we die from right away. These are things that probably affect us adversely for 20, 30, maybe even 40 years of our lives. They're chronic, they're degenerative, and they're costing us untold amounts in terms of our quality of life. So what Dr. Steve is doing is really, really trying to get to the bottom. Why do we suffer from chronic? What is that? What is it, and why are we suffering?
Yeah, and in fact, why don't you take it away, Steve? Could you answer that question right off the bat?
Yeah, well, over the years, I practiced with a microscope for at least 15 years, and I would see all these organisms in people that had chronic fatigue, fibromyalgia, lupus, ALS, multiple sclerosis, Parkinson's, and it took a long time to kind of get an inkling of what categories they were, but I just really couldn't prove what I was seeing. I knew I'd see spirochetes, they're little corkscrew-type bacteria, but I didn't have any idea how many there were, how many species and subclasses. So I had a wonderful opportunity to meet a guy who I think is probably the top molecular biologist on the planet. And I told him the problem, and I said, do you think you can help, do DNA testing to identify these? And he said, yeah, give me a little time and some capital to do it. And he did it. And it originally was called the Spirostat test, but it was very complicated, and it took a lot of time to do and many PhDs. So we pulled it about a year and a half ago, and it's just been rebuilt, and now it takes 2 people to do it, and it's very quick to do and tests for literally 5,000 potential bacteria in one specimen. So you don't have to guess anymore. And I got pretty good at guessing over the years, but I was still guessing nonetheless. And so I now have the opportunity to correlate what I see in people's blood with what the DNA says, and now I'm kind of sharpening my own tools. But I was utterly shocked at how many organisms there were that cause disease in humans, and nobody even talks about them. And they're in cancer. I've got a study. In the last 18 months, I've seen 3 patients in Mexico who, at my clinic there, for those who are not familiar with what I'm speaking of, that had a diagnosis of pancreatic cancer. And after further observing them, because there was no pancreatic mass observable on X-ray or on CT scan, but they had a metastasis in their liver and in their lungs, further testing showed that they were actually suffering from cat scratch fever. And
That's
cat
the origin.
Cat scratch fever is known as Bartonella hynsalae. There's actually numerous species there. There's a number of different Bartonella and other similar organisms, and they actually cause masses, and they look just like cancers. In fact, the university that diagnosed this guy, the pathology department, it said that the liver tumor was a hepatocellular metastasis of pancreatobiliary origin or possibly lung origin. And I looked at it and I thought, how in the world can you be a pathologist and can't tell the difference in a lung cell and a pancreas cell? And the CT scan showed no mass in the pancreas. And so I asked the wife of the patient, who was in extreme bad shape. I mean, he was days from passing away. I said, has he ever been bit by a tick? And she said, I don't think so. And I said, you didn't see a little rash on him with a little dimple in it? And she said, oh, well, yeah, let me show you. We go back in the treatment room. She pulls up his shirt, and there it is. It's been there 9 months. And so I ran the test. This guy had the highest level that the lab test for Bartonella species. Every red blood cell was coated with little dingleberries hanging off of it. Also, he had 2 or 3 different spirochetes. He had Lyme disease, several species, other spirochetes, and every red cell in his body had babesia. So this guy got bit by the wrong tick. And so he actually got 3 or 4 different infections at one time. And his general practitioner looked at the rash, said he didn't know what it was, gave him a steroid. If you can believe this, a dermatologist looked at it and said, I don't know what it is, but here's another topical steroid. And when the oncologist looked at it later, when they diagnosed it as cancer, he said, well, I don't know what it is, but it's not relevant.
Oh, my gosh.
So,
hey, Dean, I have to interject. I have to interject just for a moment, Dr. Hines and Dr. Dean. I had a guest on, Dr. Murray Susser, 88 years old, still very active in practice because the world needs him. And this is not egoic. This is not but he did a brilliant show with me on pleomorphic infections. How we talked about Lyme disease. How he talked about how there's 4 different morphologies of Lyme. Never mind the co-infections. He brought all this up. And that's why I actually had said to Dean, you have to introduce these 2 men because they're going to do great work together.
I know Murray.
Okay.
Yeah, saw him in San Diego last week, I'm pretty sure, at the iLabs conference.
Yeah, this is what we talked about.
Excuse me. One of the things you're describing is one of the blinders that science has on. You know, the kind of answers you get have a lot to do with the kind of questions you're willing to ask. And if you only have a protocol, you have tunnel vision, then you try to eliminate everything that doesn't fit in because that's where you feel competent or that's where you've been taught you're correct. So a lot of times people don't ask the kind of questions you're asking. And I really, I'm happy that you're asking them.
That's right, Dean. It's like they talk about in the days of Columbus, the Native Americans looked out in the water and they saw ships, but because they had nothing in their experience that could describe a ship, they couldn't see it until a shaman pointed out, no, it's real. It's coming. Welcome to the new America. Yeah.
And this is the point to where we get to that part of the story where Steve, I look upon that patient and see the utter desperation, and we'll talk about what happened when we come back after this commercial break.
Oh yeah, see, my co-hosts, aren't they fantastic, audience? They're just cute. Pavlov's dogs, I guess we could say. I don't know. We'll be back in just a few moments. Sometimes the bumper music makes me want to dance, and at other times I just wanted to get out of the way so we can finish our conversation. It's all yours, Dean.
All right. Yeah. Okay. So you have us on the edge of our seat here, Steve. Tell us what happened with this patient. How did you?
Well, I am so sorry to say. When I saw him come in the clinic, and we have a very good history on pancreatic cancer. So, I'd heard he'd just been diagnosed 6 weeks earlier, and I thought, this would be a piece of cake, relatively, as cancers are. And when I saw the guy in the clinic that morning, I said, oh, my Lord, this guy's yellow from head to toe. He can't hardly walk. He's in agony. And when I looked at his labs, I said, this guy probably won't live long enough to get the test result back. In fact, he died the day I got the test result back, which is only 4 days later. And he was fulminant outright hepatic failure simply because they gave him chemotherapy for what they thought was cancer. And it wiped his immune system out, and these catch-scratch fever just grew like crazy because there was no immune system left. So within a couple of weeks, his bilirubin was 7 before chemo, and it was 38 14 days later, and that's not consistent with life. And so very tragically, this guy, because of the oversight of 4 different physicians who clearly saw this lesion and didn't think it was relevant. And I'm talking, this is a classic, out of the textbook, any general practitioner would have known, should have known. This was a bullseye rash, and nobody caught it. Didn't even consider it.
Yeah, I'm pretty speechless. I can think of a lot of things I could say, none of them that would really be helpful to moving this along. So go ahead, Dean.
The tragic thing is that was three of them. One of them was a little girl in Dallas, about 15 years old. Same thing happened about 5 months ago, and another guy in Louisiana. I was just consulting on the cases. They didn't actually come to the clinic.
So I'm getting the picture that a lot of what you had been experiencing led you to make the early conclusion that the diagnostic tools that we have may be advanced in a matter of speaking, but they weren't satisfactory to what you were trying to achieve. Is that correct?
Well, no. You know, when it comes to staph infections and strep, things that grow fast, things that are commonly known and advertised, you know, you hear people going septic all the time. But there's a class of organisms that are called zoonotic, like a zoo, you know, animals, zoonosis. And they're ones that are fairly poorly known in America. They're very much more so known in the tropics. So, because in America, you know, we don't have many infectious disease doctors, and if we do, the ones tend to just look at the things they think that are common, and they only know they're common because that's the only thing they test for. And many of the things that this new lab tests for are things that are not well known, but they're actually extremely common. And it's like the guys that at the hospital, I said, you know, when somebody gets out of surgery, I promise you, Dr. Surgeon, your patient has scurvy, and you should give them 50 grams of vitamin C IV. And they say, well, how do you know that? I said, well, I've run the test before, haven't you? And they say, well, I don't know. What test would you run? A vitamin C test. You know, like
Dean's laughing, and I wish I could laugh right now, except I'm feeling a pit of fire in my belly because this is so problematic with the profession of medicine. Is we really are not taught how to think. We're taught what to think, and if what's happening in front of our faces isn't a part of what we've been taught to think, we don't see it. And you know, you said, you know, Dr. Susser, it's just the idea that we deny phenomena that have been a part of nature for as long as humankind has been around. And I don't know. Go ahead, Dean.
Well, we should be more aware. It's not that in most of the doctors that, like the surgeon that was asking you the question, well, what test do you run? When you're working in what we've talked about with tunnel vision, and I'll pick it up after the break, that's all that they're looking for. So what we'll talk about is how to expand our awareness on the flip side.
And Dean, just come back on right after the break, Dean. Don't even give me a moment's thought. Just move, okay? Listeners, we'll be right back after these few minutes. My co-host, Dean Lloyd, is going to take it away. Thanks for being with us. Okay, we're back. Dean needs a little bit of a cue. Got to interrupt the music, Dean.
That's all right. We're there. So what I'd like to do is, before we go into a little bit more into detail about how Steve has grown from his experiences here, I wanted to bring Am in to give us some perspective here on what is going on with the profession as a whole, and also how we're able to bring ourselves, either patients or doctors, to realize that what we've been missing has been more than just the bacteria testing, more than just the absence of nutrients. It's all part of this big picture. So what I wanted to do is bring Am in here to get his take on what Steve said so far and where we need to go.
Thank you, Dean. Yes. Well, of course, as we've pointed out, right now medicine is not being run by doctors. It's being run by the pharmaceutical industry and the insurance companies. And that's a shame. But let's get back. We're talking about degenerative diseases. But let's look at the thesis, antithesis, synthesis of this. The thesis is that we generate, that our bodies have a certain potential, and that's genetically programmed into us. We get in the way of that, barring assault or injury, and right now there's a lot of environmental assaults going on, either by not giving the body what it needs to adequately perform its tasks right on the cellular level, or putting the wrong quality in so that we gum up the works. The body can't perform. Now, this leads to a breakdown. And the synthesis of that is regeneration. In other words, but on the degenerative part, we get stuck on the absence of illness. I don't want to feel sick. I don't want to be in pain. I don't want to be impaired in some way. And that's absolutely true. But that also binds you, whether people realize it or not, to the negative. What we want to do is find out how good we can feel. And on the regenerative side, that involves our mental and emotional state. We've domesticated the animal. On the generative side, we're biologically, on the unconscious level, we're shells to produce seed, to produce other shells. But we're not operating on that unconscious level. We've taken the animal out of the wild. We've taught it language. We've gained tools, artifacts, cultures, customs, and today we live in these mind-generated fields where, regardless of the season or the environment, we can regulate, change things. Our bodies can and will adapt, but in and of themselves, they don't know what to do. Now, when you discover there's a bacterial buildup due to the impairment of the body's metabolic system to adequately handle things, you certainly want to try to eliminate that and give it what it needs. But a lot of what people are stuck on is emotional fixations. They have inadvertently, subconsciously, backed into ways of referencing themselves to their body, both their physical body and the social body that they're a part of. And these emotional states keep recycling tensions. They affect tissue disposition throughout the body. They influence the metabolism. So that even when we mean the best and we're trying to do good, we're stuck with a lot of patterns that keep throwing our metabolism off. So one of the things, and I love the work that Dr. Hines, Steve, is doing, been doing very similar for many years, is that we want to educate people. We want to let them know that on the regenerative side, that you can not only eliminate the problem, but say, what do I need? It's input, output. If the energy coming in matches what we're demanding of ourselves, you keep a balance. That's if you're in balance to begin with. But if not, something has to pay for that expenditure of energy. Inadvertently, so to speak, we rob Peter to pay Paul. We borrow from one organ or tissue system to feed the demands of another, which keeps furthering the imbalance because the body doesn't know. When we can grow extracts, chemicals, harvest all kinds of things, nutrients, and become aware of that, then we have to tell the body what we're giving it, what we expect of it, how it can use it. If not, through the years, I've had people come in that are taking shopping bags full of things, throwing them down their system because they read something about it somewhere, and the body doesn't know what to do. They're actually stuck in patterns, and this creates more of a tension level in the body. So just like to extend that, but jump in, Dean, and we'll continue it.
That's the missing piece that doctors are not integrated or realizing, and this is where, and I wanted to ask Steve's take on this, is that we're, in being a director doctor, we have to acknowledge these tests and their validity in each individual patient. So if they come to us and they've got an obvious bacterial infection, or they've got, chronic arthritis, fibromyalgia, or whatever comes into, we've got to acknowledge not just the disease, but where the patient's going to go if we are treating them, and what's the state of mind that they're in. What I wanted to ask you, Steve, is that through your experiences, how easily do we become susceptible? Am mentioned that there's constant environmental, what we call harassment, or downright chemicals that are directly related to getting diseases and such. What is it that you are doing to prevent these patients, or yourself even, from becoming susceptible? What's your approach?
Well, obviously, anytime you consume the standard American diet, you are going to be short on the immune system pole, and you're going to be subject to things that you might not otherwise become. It's just like people that get chronic beta strep infections, chronic tonsillitis. They're all eating gluten, and then they're getting an infection, and they get an antibiotic to treat that infection. And eventually, they end up with chronic otitis media, which is 94% proven, I believe, by even Mayo Clinic, to be a fungal infection. Well, so you start out eating something that's been tampered with. It's not even real food anymore. It causes the immune system, the GI tract, to become impaired and inflamed. Then the tonsils get infected with something. Then we treat it with an antibiotic and do not replace the probiotics, which is near impossible anyway, because you can't fix, 300 or 400 strain gut with a 1 or 2 probiotics. But then you end up losing the commensal flora in the ears. So you get one thing, we treat it, we cause something else and something else. So, it always, to me, comes back to don't eat genetically modified foods. Don't eat a lot of grains. I found that the book that co-author of, it's probably 60% of the people that go on that, and they have lupus and fibromyalgia and chronic fatigue, within 2 months, they're absolutely new people, even though they may have some infection. The other 40%, their infection has just gotten to the point where we have to deal with it before they're going to improve much. But, one thing that just absolutely tears me up, and I've seen it twice this week, is root canal teeth.
Oh.
Root canals, my Lord Jesus, help me. How many? I've seen 6 triple-negative breast cancers since I've been cognitive to watch. So we've done thermographic imaging of the head and the breast, and there was a root canal tooth on the right or left mammary meridian, and it lit up like a Christmas tree with a white line right down to the triple-negative breast cancer 5 out of 6 times. Just this week, I had a girl with a breast cancer metastasized to the lung, chronic cough. They assumed it was from the cancer. I had the dentist in Mexico pull the tooth. It had gangrene on it, and there was a post drilled through the root of the tooth. It's unbelievable. And it was just so vile looking. I showed it to some of the people in the clinic, and I thought they were going to go throw up. It was so putrid when it came out. It smelled like a dead deer rotting alongside of the road. And I see this a couple of times a week. I've seen people get out of wheelchairs after 4 or 5 years, after sending them to a biological dentist who appropriately took out the infected root canal teeth, removed the infected socket, and within days, they start getting better. This lab test, when we had it up and running a few years ago, I ran 5 ALS patients. Lou Gehrig's disease, like you don't get well from that, right? 3 out of 5 showed positive levels in their blood for Treponema denticola. This is a syphilis family bug that is common in the oral cavity, but it should not be in your blood or your central nervous system. And I just had several ALS patients in the last few years, but one 3 weeks ago took 12 days of the appropriate antibiotic, and his slurred speech and his ataxia was so much better in 12 days, you probably couldn't have picked him out of the average person on the street. But if you don't know that you've got Treponema denticola in your brain, you are not going to get well. It is the only thing that I've seen that will treat it. And I've seen numerous ones, and I've tried to get them well with PO antibiotics, every herb, Rife machines, ozone, peroxide. Didn't work. It took IV Rocephin antibiotic with DMSO in the bag and Flagyl with DMSO in the bag 5 days a week to kill that organism in the central nervous system. But that was after finding why they had it there. It's because they had dental infections, root canal teeth mainly, but sometimes just infected sockets.
Okay. Listeners, we have to go to another break. I don't know about you. I'm mesmerized by the conversation. I have 1,001 questions, but I'm going to have to hold on to those. We'll be back in just a few moments to continue our conversation. Thanks for being with us. You're here on Uncommon Awareness, and this is our twice-a-month program of Evolving the Species. And Dr. Hines just gave us his discussion was stunning for me. And my co-host and colleague, Dean Lloyd, is actually has prepared a number of different questions for Dr. Hines. But I don't know about you. I'm really stunned by what he's been saying. And I know this. I guess I just didn't realize the extent to which it was actually playing into so much of what we're dealing with today in our country with the chronic degenerative disease. So, Dean, please go ahead. Right,
and I would like you to have those 1,001 questions all answered for you, Lorraine.
But you know what? I mean, from what Dr. Hines just said, from what Steve just said, I'm telling you, Dean, I could do a week's worth of programming. So don't get me going.
But we are intending to get you going. That's the whole point. Well, in this, okay. So, Steve, what I'm wanting to, for the benefit of the listeners that aren't familiar with some of these degenerative issues, and to bring it round to where we're identifying nasty bugs, right? Nasty,
yes. Very nasty bugs, yeah.
Very nasty bugs. And what we have to prepare ourselves not for just the individual disease. That's the misconception. Doctors are trained to say, avoid heart disease, or avoid cancer, we cannot think like that. And it never served us in an appropriate, adequate, efficient way. So I wanted to bring Ann back in on this because what Steve's story, it identifies these are the horrible things that we know are going on, but we're moving past that. We've already established that these are there. They exist, and these tests that fortunately Steve has been able to investigate and make our testing process better. What is it that you see, Am, in our next step as far as, because he's talked about these very difficult things to treat. He had to put DMSO in the bag and go through this type. This is a very sick
Dean,
person.
Yeah, listeners may not understand that that's a form of oxygen therapy. So just kind of just try not to keep. Just explain to listeners what that is.
DMSO is actually a polar solvent. It's derived from the wood pulp industry, and it makes the antibiotic like a ghost. It just goes through cell membranes and into the organelles of the cell and into where the infection is. It just makes the antibiotic get where you want it to go.
Yeah,
Thank you.
it's a directive agent, and but bringing Am back into this, what you've just heard, can you give me what is your perspective on attitude here?
Well, first of all, most people are in a constant state of anxiety. We think all kinds of static thoughts, God, truth, infinity, whatever, but we scratch ourselves and we bleed and we go, oh my God, I am mortal. And it's that sort of vulnerability that hangs over everybody's head. Most people are very wrapped up in that. And in some ways, not that anybody would consciously seek it on a rational level, but we make a self-fulfilling prophecy out of our own fears and anxiety. And it seems to justify, well, it's not my fault. I can't help it. This is what's happening to me. And a lot of times when people come in, they're very invested in that. There are excuses for why it's not their fault and why they have to suffer. And the body, without realizing it subconsciously, it's not because this is irrational. This is below the conscious level for most people. It doesn't have to be, but that's where most people are operating from. They are creating issue dispositions. And so part of it, there's a lot of things that can make people feel a lot better, enhance their performance capability. But you can't give that to people when the body is imbalanced. When it's toxic, it wouldn't know how to use them. Also, if you're locked into a certain pattern and you start dumping high-tone nutrients, target-specific nutrients into the body will stutter between what it's used to, how it's locked into responding, and where it needs to go. This is where becoming conscious and directing the body, which is a
those words.
art form.
Becoming conscious. Right now, I'm conscious of a commercial. I'm so sorry.
Of course.
I'm conscious of a commercial, but I'm listeners. I'm so mesmerized at what these guys are talking about. This is kind of deep stuff, and maybe I'll have an opportunity to introduce it shortly. We'll be right back after this break. Okay, once again, listeners, you're participating in Uncommon Awareness in our twice-a-month show of Evolving the Species, and every show is great, but this show is really particularly stimulating to me because there's nuances. So if you've been listening, great, and if you've missed any part of the broadcast, please go back and get the archive. But in the interest of time, I'm just going to let Dean pick up where he left off.
Well, thank you, Lorraine. And what was being said in the last segment was leading up to one word, and that to me is adaptability. Our environment is not the same, and our relationship is not the same to our great-great-grandparents. We have to deal with electricity all around us. We have to deal with, obviously, the environmental toxins and so on. I don't want to get too much into that, but I do want to talk right now about how are we, as a species, going to be able to adapt to what's coming. How are we able to protect ourselves, defend ourselves, keep ourselves on top of the game?
Well, thank goodness we've got people like Dr. Hines, huh?
Yeah, well, kudos for his work in this area. But what Steve has been successful in is recognizing all these holes in science, right? And that, right. In other words, he's identified, hey, you're not looking in the right place. And even in the that first story he told us, what would be considered obvious first-year med school type of, attitude, our observation, we're losing our ability to reconnect to the human as a full conscious being, or a being that's becoming healthy instead of it becoming sicker and sicker. One of the terms of just getting diminishing returns. You're only going to get sicker. You're not going to overcome these things. So without having to get too wordy here, I wanted to bring Am into his conclusions, or his insight into how are we going to adapt, and where are the tools that bring us into a place
our X factor man.
Yeah, to bring us into that place, that conscious place.
Talk to our soul.
Here I come to save the day. Well, it's time for humanity to finally come in it's becoming human. And for that, it means the potential that's been touched upon here and there by mythological or legendary characters throughout history, for that to become a new bottom line, not set off as a lifestyle where people confuse what was brought forth, the state of mind that was exemplified, with the cultural attributes of the time, and then keep trying to replicate that. It's time for people to become secure, comfortable, and open in themselves. And let me emphasize, to explain how to do this would take more time than we have on this show. But let me tell you what's available, why it's necessary, and what it would mean to us. Right now, the beast needs a good master, and right now the physiology is being buffeted around by irrational subconscious patterns. Of course, the assaults we've been talking about, the poor nutritional qualities, but all these emotional patterns keep it locked in. The physiology keeps emphasizing the emotions we've created. The emotions keep locking in our physiology. We can try to objectively abstract ourselves from that. We come up with brilliant insights and thoughts, and that's okay. You may become very competent. But what's lacking right now is psychological integration. And what that means is for people to start operating comfortably, clearly on fourth level consciousness. Now, people talk about the meditative state. They know through biofeedback that if you can quiet the mind, slow down the nervous system, there's less strain. The organs can become more quiescent. They can function better. If an athlete wants to increase performance, besides the right diet and exercise, they need a certain mental state. The state that is needed is one of being able to move into a comprehensive awareness of everything going on within and around you at any given moment without feeling compelled to mentally label it, emotionally react to it, and throwing the body out of kilter. When you can activate, and this is all accessible to everybody at whatever level they're operating from in terms of their development. When you can operate from that state, you feel secure. You start to see other ways of processing. You're not stuck in trying to justify the patterns that you feel locked into. You can more easily take them apart. You can see where they're of service to you, where they're not of service to you, where they came from, and you can start to rewire them at will, not as an intellectual idea, but as an actual access in the body and the mind. Now, that brings about a whole different quality of life. And I hear the commercials coming up.
That's right. Hold that thought, Am. We want you to continue sharing that with us. Listeners, we'll be right back. We do have to take yet another commercial break. I certainly hope you're as stimulated as I am by this conversation. We've got some phenomenal ideas. Okay, we're back. And I didn't quite have a chance to finish my thought. What I wanted to say was, these Evolving the Species roundtables are really a phenomenal opportunity where brilliance is easily recognized, but there's a synergy, and I'm not claiming that but there's just a synergy when you've got really deep thinkers, people that are moving and acting and living in their lives with intention and purpose. You get this rare thing called Evolving the Species. That's where we're at. And Am got cut off before the break, and I just want him to continue his discourse.
And thank you.
Thank you. We're talking about syntropy here. Entropy, any organism or thing that comes into existence is a containment field for energy. And by the quality of the energy and the quality of the containment field to define its form and function. But if you use up that energy, then the form and function can't operate. Finally, the energy dissipates, and we call that entropy, one of the laws of thermodynamics. On the other hand, there is syntropy, and that's what we're talking about. Being able to bring in more energy to refurbish, regenerate, and expand the interactive qualities of any given system. That is a conscious process. If you're taking vitamins, if you are trying to avoid certain toxins, if you're doing exercises, then you're using the mind to try to help the body. But there's a whole nother level. You know, we hear it talked about, yogis, mystics, what have you. But once you understand what's going on and you can divest yourself of all the cultural toll booths that have been established because people didn't actually understand what was going on, you can start to gain control over the body. You can start to work with the organs. You can work with the glands. You can work with secretions. If you're taking food in, you can help the body. You know what you're taking in, what kind of fuel it offers you, and how to help the body use it. If you're trying to detoxify, you can calm and help the organs work. You can help the muscles, the ligaments, the tendons, all of this is accessible, and that we're just talking about baseline functioning. If you have enough physical vitality to feed your mental, the needs of your mind in your daily routines, well, then you just go through. If you have a surplus of that, then the mind can get through its daily tasks with ease. That takes you into the place where you have an excess of mental energy, and now you can go into the creative realm, where you can see ways of positioning yourself to get more energy, to become more creative, to become more relaxed. And relaxation is unwinding the nervous system is very key to that. Now, we've gone on this for hours, and we could get very functional, love to, in describing exactly what's involved, because this is exciting. When you really have control, I don't mean avoidance, escape, denial, suppression, but when you can move in and out of the various levels of consciousness, the physical is the first, your feeling responses are the second, your conceptual intellect, how you reference yourself through symbols, to form and function is the third. But when you can grab hold of all of these, mix and match them to your heart's content, use them, or simply remain in the moment, aware without having to respond, always having the option, well, then you're in a whole different ballgame. Nobody can cheat you, manipulate you, hypnotize you, push you around. You'll stop doing that to yourself. Then, given the chance to interact, you're going to do it for all you're worth because you're no longer afraid. If it feels good, you will come towards it. If not, you can extricate yourself without having to sell yourself some sort of a justifying song and dance. There's so much more I'd like to say, but that would take quite a bit of time. But if there's anything you would like me to enumerate on, please.
Well, and we will, Am. I want to bring Stephen for a moment here because what he's seeing in patients with their tissue dispositions and their constitution, he's asking the question, and correct me if I'm wrong here, where are the stressors that cause this patient to get so emotionally diseased or physically diseased? How do you give us your perspective on and how you see patients in how they're coming to you and what their state of mind, how you get them so that they see another way?
Well, one of the things my office staff says all the time, particularly when a fibromyalgia patient calls, they just cringe because they're like crazy, manic, depressive. They feel bad. They're short-tempered, and they're just like all over the place. And after a while, when we finally, we run this test on them, or we did, we will soon when the lab's up and running in a few weeks. But we actually found out what was wrong was that they had Lyme disease in their brain, or they had Bartonella in their brain. And it actually is known, particularly in the psychiatric world there's a Lyme literate psychiatrist who I always love to read her stuff because she says 80 to 85% of our chronic schizophrenia, OCD, manic depressive behaviors, psychotic episodes are due to a zoonotic infection. And after seeing these people come in this emotional, crazy, out of control world, and finding the organism, successfully treating it, and then they just become normal, happy people. They don't need their antidepressant medicine, the anxiety, because
we just dropped. Steve? I think we just lost.
Literally, we're not a blessing. Hello?
Yeah, we lost
got
you
you.
for a second there. That's
Okay.
Just pick up for
Are you
about
back?
20. Yeah, we're back. Pick up about 20 seconds from if you could before.
So they're when you see these people come in and they're so psychotic and crazy and they're on these meds because literally their brain is on fire. They do not have control. They want control, but they're driven by something bigger than themselves. And when you kill the organism off that's destroying their quality of life, then suddenly they're happy, normal people. They don't need their panic, anxiety, depression medicine. Their energy's up. They can now exercise. Now they can lose weight. And so it's hard to, you've got to have the mind, you got to look at we don't treat patients. We don't treat diseases. We treat patients. And we have a staff counselor who is really good at helping discern how much of this is that this lady is just not willing to let go of the fact that her husband ran off with another woman and she's mad as fire, or that's not it at all. She just is so depressed because she's got a bug in her brain. So once we discern that with this really cool test, then we can then give them hope that now we know what bug is messing with you, and it's going to take a month or 6 weeks and sometimes a year, because you can't kill all these bugs overnight. These secondary immune system can make you feel so bad, but at least we know what it is. And if people know what's messing with them, even though they still feel bad, at least they see the light at the end of the tunnel, and I can say, look, you're going to feel really lousy next, and I'm going to make you feel really lousy, but it's for a good reason. And as long as they see it coming, they can do it. And then I'll give them for 3 days. Hey, I'm going to let up now, give you a holiday, and when they feel good for a couple of days and they begin to trust us that we really know what we're doing, and it's so wonderful to not be guessing anymore. And that's why, I've been a year and a half without this test, and I had to go back to guessing, and it was so much of a bummer to just.
Yeah.
I'm a pretty good guesser, but I got a study here that shows out of 786 lymph node biopsies. These are people, they were told they had cancer. Listen to this, 49.7% of those lymph node biopsies showed cat scratch fever or Mycobacterium species. Now, that's just the only thing they tested for.
Well, and we're talking about infections like none of us have been really taught to understand and think about infections. We're talking about a seeding of a bioterrain. Yeah, I'm sorry, Dean, go ahead.
No, you're right. What Steve is mentioning here, and the point that I'd like to make even more of, is that when the patients do see a test that validates that there is something wrong with them, they're not as much in the fear that they're not going to be able to accomplish some kind of treatment strategy that's appropriate for them.
Right.
And they go through stages, and Steve appropriately also identified that, hey, we're going to have to turn it up here. I oftentimes call it the fire-up stage, where, I start the process and then give them the real, the vigorous protocol, and then what stages they'll go through. And they're so comforted by that. And this goes back to what Ann was bringing up about, and you mentioned it, Steve, about willing to let go, and how patients are so invested in their emotional baggage and how much is really keeping them from healing. So, and I wanted to get some solutions on this before I go into the break here. But Ann, please, could you just jump in for a minute on that piece?
Well, yes, sure. It's all right. You can't serve two masters, so to speak. You can't serve both fear and understanding. Now, most people are serving their fears. They're locked into that. There's a reason for that. There's an actual mechanism of consciousness that's become very thrown off kilter in human development that can easily be corrected. But in what you've been saying, health is seductive. If you can be introduced into a better state of body and mind, once you've tasted it, even for a moment, you've managed to get away from the pain, which is not pleasure, but that's a start. Then you know it's available to your nervous system. Whether you've consciously registered on that, you know something is better. You will be haunted by the fact that there is a more expansive, more comfortable, more energizing state of body and mind available to you until you can make it accessible. But, of course, a lot of people don't understand what they experience. They make up stories, it must have been my imagination, I had a good day. No, if you've had it for a moment, by any means, it means it's accessible to your nervous system and the workings of your physiology. People aren't depressed when they're full of vitality. So we're looking at what not only keeps you from feeling vital, but what can enhance that quality for you and make life more of a joy, more of a pleasure, as it should be.
We have to go to what I believe is our last break for today. Boy, listeners, I don't know about you. This has been a phenomenal show. Talk about mind-bending, mind-blowing, mind-stimulating. We are winding down today's program of Uncommon Awareness, which is our twice-monthly roundtable called Evolving the Species with my esteemed and delightful co-hosts, Dean Lloyd and Am Rosen. Our guest today has been Dr. Steve Hines, and he's developing a laboratory that is really, progressive. Let's just call it progressive, with the understanding that a lot of what is going on with us is a result of chronic infections. A lot of our chronic degenerative disease is due to chronic infections that are not manifesting the way that we've been taught in terms of acute infectiousness. So, listeners, I am so privileged to be a part of these kinds of conversations, and I hope you've enjoyed the program, but I am going to let Dean take us out.
Thank you, Lorraine. It's so good to feel your energy and excitement because because we're not the old image, where you have these doctors stooped over in their white coats with gray hair, and they got thick glasses, and they're kind of muddling around, going around from treatment room to treatment room. We're healthy people.
You're not just healthy people. You're men full of vitality and full of creativity and full of motivation and full of innovation. I mean, I'm genuinely excited to be in your presence.
Well, I appreciate that, but it feeds on it. This is what Am was saying. With it, when you taste it, you've got it. You're left to crave more and more of it. And before I bring Steve in here real quick, because I want him to tell us about his new laboratory.
Well, I certainly hope he'll come back to the show with us.
I think we can twist his arm and get him to come on back. But I wanted to to finish up on what Am was mentioning, that when people that are going through your process of diagnostics, and they're given the tools to understand that these are the best tools that we have, you're given the opportunity to see the patient from a point of view that says, we're not going to just rely on these tests. These tests are absolutely, in our day and age, I think they're a requirement for many people. And you've got some things to tell us about that. But I just wanted to make sure that I was hearing you correctly, and that when you said, you had staff or people that were appropriately trained or are able to take on these variety of different, what we'll call physiological and emotional states. Are you in that place right now where you feel that you've made that next step in advanced in healing, not just being in the medical field, but in healing, where you can make a statement? Do you feel that?
I've had people that I've treated for 2 months with everything I had and made no progress with them. I send them in to speak to Marco, our staff counselor. An hour later, they come out laughing, crying, joyous, and their tumor starts breaking up within a week. So it's a three-legged stool. You've got to deal with the emotional, the spiritual. You got to deal with the bacterial, the toxicological, and you got to deal with the diet and nutrition. But what's been, we've got lots of goodies on nutrition, and we've got lots of wonderful books written on how to conquer your hatred and your bitterness. But nobody's really ever been able to say, it's kind of the Star Trek thing, a little tricorder, you scan the body and it's, this is what's wrong, and it fixes it. This is so exciting that our lab director is such an incredible genius guy. It literally, you could be a lousy doctor. Just send their patient's blood. It's DNA sequence.
Steve, you have no idea how many times I have held that image that you just described in my mind saying, one day,
literally,
one day.
We're talking about sending your vial of blood in and DNA sequencing potentially 5,000 bacteria.
Well, I wanted you to say before you leave about your K53 laboratory. Where do they find out about it?
It's ks3labs.com.
Okay.
K as in King, Sally, the number 3, labs.com.
And you know what? I'll be sure to get that on my blog and on Facebook, Steve. Dr. Hines, gentlemen, thank you so much. Time goes by way too fast. Listeners, thanks for being with us. I really hope you appreciate what we're attempting to accomplish here on Evolving the Species. It's for your edification. It's for your understanding. This is how we get well.